Idaho Matters is brought to you in part by St. Luke's Pharmacy, now offering free home delivery. For daily medications or one time prescriptions, home delivery is easy to set up. It's convenient and safe. St. Luke's Pharmacy, now delivering to your doorstep. Information on how to get started at stlukesonline.org.
So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.
More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. E-scooters and e-bikes, well, they're everywhere, and you're supposed to wear a helmet when you're using them. However, that doesn't happen often, which means when there's an e-scooter crash or you just fall off, the trauma your body experiences is so much worse. Physical trauma comes in so many forms, from car crashes to simple falls, which are the top trauma injury for our area. And St. Luke's and St. Alphonsus medical teams work together to not only treat them, but to try and prevent them from happening in the first place. And since May is Trauma Injury Awareness Month, we asked Dr. Brittany Hill, System Trauma Medical Director for St. Luke's, and Andy Esslinger, Director of Trauma Services for St. Luke's, to join us to talk more about this. Welcome to the program. It's nice to have you both with us today.
Thank you so much. We're happy to be here.
So, Dr. Hill, let me start with you. Can we talk about a trauma injury? What makes up a typical trauma injury?
So a trauma injury is generally something that happens from an unexpected event, generally an accident that causes injury. So that can be anywhere from you fell down and you broke your wrist versus you were in a motor vehicle crash and sustained trauma to multiple parts of your body. And so we have a system of trauma centers that is designed to care for a range of injuries. And we really work with our partners, both other hospitals as well as pre-hospital, to make sure that we get the right patient to the right place.
Is there a difference between labeling something an injury versus a trauma injury? And if that answer is yes, Dr. Hill, does that matter?
It does not matter in that most injuries do come from some sort of trauma, whether it be a fall, a knife wound, a gunshot wound, a car accident. So in general, most injuries are from some sort of trauma.
So, Andy, let me bring you into the conversation. Can you tell us a little bit more about St. Luke's Trauma Care Program and what it does?
Yeah, so for our program, what we do is we take care of the patients that present to our emergency department and even other hospitals that need our care. They can transfer them in to be admitted to our hospital, but we work in conjunction with our pre-hospital teams and care for those patients and ensuring them that they get follow-up care even after the hospital stay. So following the whole continuum of preventing an injury, what we need to do to work with our EMS partners, how we take care of patients in the hospital, and then after, and helping them rehabilitate to get back to their way of life.
So, Andy, my understanding is that St. Alphonsus is a level 2 trauma center, and then St. Luke's Children's Hospital is a level 2 pediatric trauma care facility. Can you tell us about what these levels means and why they're important?
Yeah, so the levels, trauma center levels are based on, they have 1 through 5. So for St. Alphonsus, a level 2, it's all based on the resources that are available. So the pediatrics at St. Luke's, we have certain specialists there available to care for our pediatric population, and St. Alphonsus has those mirrored resources for our adult population.
So, Andy, how do St. Luke's and St. Al's collaborate to help trauma patients? I mean, how do the two systems work together collaboratively?
Go ahead.
I'm going to take this one. So
Okay.
we work very closely with our trauma program cohorts at St. Alphonsus as well, to ensure that we are doing things in a similar fashion. So we use the same protocols. For example, for traumatic brain injuries, there's a state recommendation on treatment for traumatic brain injuries, which both St. Alphonsus and St. Luke's have adopted. Both systems were very involved in the formation of that protocol. And it just helps that when we identify a patient, as Meridian is a level 3 trauma center, if we identify a patient that needs a higher level of care, particularly neurosurgical care, then we are able to work closely with our partners at St. Alphonsus to get that patient to that level of care and make sure that we're starting those protocols even before they've arrived at the level 2 trauma center. In addition, we do a lot of education. We teach advanced trauma life support with our partners at St. Alphonsus. We're both having people taking the courses and teaching the courses from both facilities to really make sure that we're all working together to get everybody in the community the best trauma care that we can provide.
So, Dr. Hill, what is the most common trauma injury that you see here in our area?
I would say that the most common trauma injury that I see is going to be falls. And so gravity always wins. And so in general, we see a lot of falls, whether they be an elderly patient who has slipped and fall or tripped over a rug versus also falling from height. So falling downstairs, falling off of, a ledge, etc. So really, in the end, falls are most common.
And what kinds of injuries do you see from these types of falls?
So we would see orthopedic injuries, so wrist fractures, tibia, fibula fractures. Rib fractures are a very common injury that we see at our level 3 center in Meridian, leading to admission. And those would be the most common that I can think of, as well as traumatic brain injuries. Any others, Andy?
I think definitely the orthopedic, so wrists, ankles, and ribs definitely are our top ones.
So we are getting into the warmer months. Summer's heading our way. Dr. Hill or Andy, do you start to see different type of injuries that happen at certain times of the year? And are you gearing up to see certain injuries as we head into the summer?
We do see different patterns of injuries. For example, during the winter, you'll see people who've been on snowmobiles, skiing. There actually has been a decrease in some of the trauma that we've seen in McCall and Wood River associated with the poor ski conditions because not as many people were skiing. As we gear up for the summer, there's really the 100 days of trauma that ranges from Memorial Day to Labor Day, and people are enjoying the outdoors. They're on boats, they're on ATVs, they're driving at greater rates of speed. So we definitely see higher acuity of trauma and higher mechanisms.
Yeah, and I think with
So, Dr. Hill,
summer...
Oh, go ahead, Andy.
go ahead. Oh, the summer injuries
continue.
also include burns, especially right around the 4th of July, people having campfires, those kind of things as well.
So I'd like to turn now and talk for a minute about e-scooters and e-bicycles because they are everywhere nowadays. It doesn't matter if you're in Boise or another city. And I am curious to know if you are seeing more injuries as these usages continue to become more popular.
Yes, we are. Previous years, you wouldn't have thought anything about an e-bike or an e-scooter injuries. And with the availability and the popularity of the e-bikes and e-scooters, we are seeing a very strong increase in the injuries associated with them, with or without helmets. People thinking that they don't go as fast as they do. You will be surprised on how fast these scooters and e-bikes move in comparison to just a regular manual bike. But yes, we are seeing a lot of those orthopedic injuries, those head injuries associated just from those e-bikes and e-scooters.
So, Dr. Hill or Andy, how do you then prevent these kinds of injuries? I mean, are there things that are happening and working with the community to try to prevent some of this?
So one of our goals as a trauma program is basically to put ourselves out of business. A good trauma program really has really great injury prevention efforts as well. And in concert with, what St. Alphonsus is doing, but also as St. Luke's Children's, really trying to provide information and education about bike helmets. We have bike helmets in the emergency department to provide to families if there's a need. And really moving forward with that. I think that looking at the rules that are put into place as well, a lot of times the technology of our toys, so the e-bikes and the e-scooters, the development and those out, going out to the community definitely outpaces our regulatory actions. And so there aren't a lot of specific rules to how fast can an e-bike go before you have an age cutoff? What are the helmet requirements and such? And so other states are starting to move forward with some of those regulations. And that's something that hopefully we will see continue to be more widespread as far as if you're 12 years old, you can't be on an e-bike that's going 35 miles an hour without some guardrails.
So May is National Trauma Awareness Month, and the theme this year is stay focused, stay safe. How does being fully present in the moment help avoid these types of injuries?
All injuries are preventable just from the awareness. I can give you a couple of examples. During the summer months, we see a lot of water submersion. And so paying attention to your children, to your loved ones, when you're getting into that water, never swimming by yourself, those type of things, as well as driving. Everybody's having a good time, but to text your friend to say, I'm almost there, it's taking your focus off the road, and that's where accidents happen and injuries occur with those accidents. And so staying focused, we just want to encourage people to be present, to keep an eye on what's going on and what's in front of them. Put those cell phones off to the side. Yes, we want to take beautiful pictures, but we want to also make sure that we're paying attention to our surroundings. And, if you're mountain biking, paying attention and watch out for the rock or watch out for the tree and be present to having fun during the summer.
Well, I want to thank both of you so much for taking time to talk with us about this. Some really good information. We've been speaking with Dr. Brittany Hill, the System Trauma Medical Director for St. Luke's, and Andy Esslinger, Director of Trauma Services for St. Luke's. We've been talking about trauma injuries. May is Trauma Injury Awareness Month, and we'll make sure to put links on our website, boisestatepublicradio.org. Thanks so much for listening to this episode of Idaho Matters. And for quick news of the day, start your mornings with our podcast. It's called The Connector, Idaho Daily News. Know someone who might enjoy our podcast? Be sure to share it with them today.
Every day on Up First, NPR's Golden Globe-nominated morning news podcast, we bring you 3 essential stories. At the heart of each story are questions. What really happened? What really mattered? What happens next? At NPR, we stand for your right to be curious and to follow the facts. Follow Up First wherever you get your podcasts and start your day knowing what matters and why.